June is Men's Health Month. According to the CDC, the leading causes of death for men are heart disease and cancer. But regular screenings and preventative care are crucial. To learn more, we turn to Dr. Anthony Weaver, an internal medicine specialist at U of L Health Shelbyville. Thanks so much for taking some time with us today,
Oh, you're
Doctor.
very welcome.
We're very happy to have you here. So let's start with prostate cancer. What are some of the signs people should be looking for, and when is it time to go to the doctor?
The thing about prostate cancer is it doesn't necessarily have many signs. If a person has blood in their urine, they should certainly get that checked out. But most of the time, it doesn't cause symptoms, which is why it is a good idea to screen for it.
Okay, so talking about screenings, we know they are crucial. It's so important. What would you say to convince someone to go ahead and go to the doctor, get checked out?
Well, I think most men are aware that they need to plan for their retirement, and they make a financial plan. But if you don't plan for your health, you're not going to be able to enjoy the money you've saved for your retirement. So make a health plan as well as a financial plan.
If you do have someone come in and let's say prostate cancer is a diagnosis they get, is it treatable? Are there actions to take?
If you pick it up early, the 5-year survival with prostate is close to 100%. That is, we can treat this if we pick it up early. If we wait till late, it is harder to treat.
And when it comes to men, for some reason, they're less likely to go ahead and make that doctor's appointment. Why is it so important?
I think men, when they get to be grown-ups, they forget about medical care. They don't have to have regular screenings in their 20s and 30s like women do. And so they become very suspicious, and they tend to try to go it along. And you know men are well-known do-it-yourselfers. They're going to take care of it by themselves. Yeah. And so I think those things come together. There's a suspicion that, that medical doctors are going to make rules. They're going to find something wrong and going to scold you, when actually it's important to make that plan to make sure that you are taking care of your health as you get older.
So we're really excited to tell people about this event coming up in just a couple of weekends. We know that you guys are doing it for this very reason, to get people out, to making an appointment. Tell us about the Shelbyville event.
Well, this is a chance for a man to dip his toe in the waters of healthcare rather than have to go make an appointment and to enter full force. It is a chance to get screened for prostate cancer, a unique cancer that affects men. It also is a chance to get cholesterol tested and glucose and blood pressure, and those things are risk factors for heart disease, which is the #1 cause of death, as you mentioned. It's happening at Shelbyville. We're going to be doing it June 25th. There is a number to register, and you need to call that, 502-647-4300. That's going to be important.
Dr. Weaver, thank you so much for joining us today, and I'm looking forward to having you on again later because you have so much important information. We really appreciate it.
You're very welcome.
Okay, thank you.